common type of hernia is this indirect hernia, which is also the inguinal hernia. In men and women, this is the most common one, indirect or inguinal. Okay, so let's look at some anatomy and everything about this indirect. Then we will move on to direct hernia. Direct hernia means it just comes out directly, right? It doesn't go through the canal, inguinal canal, etc. Then what else shall we look at? We will be looking at femoral hernia. We look at umbilical hernia, incisional hernia, epigastric hernia. Then we will look at this spigelian hernia, lumbar hernia, obturator hernia. So many types of hernia, isn't it? So we will start with the most common one, that is this one, that's the inguinal hernia, you can see here. So guys, look at this, you will have to learn the anatomy we told you, right? So look at this, this is your inguinal canal, right? And here you have the testis. What else do you see here? This is the external opening, this is the deep ring, right? This is the superficial ring, or this is the deep ring. So guys, we are looking at some important anatomy. What are we currently looking at? The indirect hernia. So first we have to look at some anatomy, isn't it? So here you go. So the deep ring is a defect in what? In this fascia transversalis. That is this one. It's a defect in the fascia transversalis, and the superficial ring is a defect where? In the aponeurosis of the external oblique. So external oblique defect will give you this superficial inguinal ring. Remember guys, are you focusing? We are looking at indirect hernia, inguinal hernia, because it's the most common in men and women, right? So what did you understand? So via this you have the viscera, your bowel or anything content coming out, right? Protruding out. So that will become a inguinal hernia or an indirect hernia. Both are the same, aren't they? So about this anatomy, see what the textbook says, guys. So it says that the inguinal canal is around 4 cm in length from the deep ring to the superficial ring. Here they're talking about the boundaries of the inguinal canal. Anteriorly, what is there? You have the aponeurosis, external oblique aponeurosis. Superiorly, you have the conjoint muscle. Inferiorly, you have the inguinal ligament, lacunar ligament on the medial side. Posteriorly, you have the fascia transversalis, which is giving you the deep ring, isn't it? The conjoint tendon medially, okay? The other thing that you have to know is the contents of this inguinal canal, guys. You have the spermatic cord, ilio-inguinal nerve, genital branch of the genitofemoral nerve, okay? So you have 2 nerves here. Round ligament in female. So it is not just that, sometimes when you think about this inguinal canal and spermatic cord, you think it's only in men, but it is there in females also, the inguinal canal. So in men, what does this inguinal canal have? The spermatic cord. And females, what will it have? It will have the round ligament, okay? And it will also have the vestigial remnant of processus of vaginalis sac. So people, here you can see the types of indirect inguinal hernia. Right, so here you can see that this is the deep ring and this is the superficial ring, right, or the external ring. So when it is within the canal, it is called as bubonocele, and when it is coming out of this, but it hasn't come out fully, it's incomplete, and the complete one you can see here. Here you look at the normal one. This is the normal for process vaginalis. It's not patent, isn't it? You can see this one. And here there is a patent processus vaginalis, which is bringing in the content, right? So this is a complete inguinal hernia. In between looks like you have something which is incomplete. So what is this bubonocele? Clearly it is bubonocele is within this inguinal canal. At this point, so guys, actually indirect means what? Indirect hernia means the hernia is not coming out of some weak abdominal wall, right? It is indirectly coming out some space that has it's coming out of that, right? So basically it is coming out of this inguinal canal. Here you have the deep ring, here you have the superficial or the external ring. So via this the viscera viscus is coming out. So that is indirect hernia. Indirect, one of the types is inguinal hernia. So guys, we are looking at indirect hernia. Look at this, the parts of the hernial sac they're talking about. So here they're talking about this is the sac, right? Sac will have contents, remember. So the sac will have a neck here and a fundus here and a body here, okay? Fundus, body and neck, okay? This is the parts. Now, types of indirect hernia, we already told you, bubonocele, where the processus vaginalis is confined to the inguinal region, right? The hernia, basically what's this? It's not patent, right? The processus vaginalis. Then if the processus vaginalis is patent up to the root of scrotum, this is incomplete or funicular, they're calling it as. Then when the sac is patent up to the bottom, it will become a complete scrotal hernia. You have already seen this, haven't you? So this middle one, they're calling it as what? Funicular. Okay, funicular, this is complete, and this is bubonocele. So now let us say there is an indirect inguinal hernia. Now from outside to inside, what and all will you see? Okay, what and all will you get? First you will get skin, obviously everybody, even small children will say from outside you will get skin. After that you will get 2 layers of superficial fascia. That is the campus and the scarpa's fascia you will get. Okay, fatty and membranous fascia. Then what will you get? External spermatic fascia. The same thing, external oblique aponeurosis, right? That external ring is there, superficial ring. Then you have the cremaster muscle and fascia, a continuation of the internal oblique. Then you have the internal spermatic fascia, that is from the fascia transversalis. Then you have the extraperitoneal fat, and then you have the peritoneum. So exactly, if we say that the what am I saying, hernia is here. Let us see what will you see from outside. From outside, well, what will you get? Skin, yes. Then you will get the campus and scarpa's fascia. Then you will get the external spermatic fascia. Wait, let's see this in this diagram. First we will get skin, okay. Then you will get the 2 fascia, campus fascia and scarpa's fascia, okay. Then you will get the, what are they talking about? I'm missing that. You will get external spermatic fascia. Can you see that here? A continuation of the external oblique aponeurosis. Okay. So a continuation of the external oblique aponeurosis. So this one. So external spermatic fascia. Okay, inside that, this brown one, that is the cremasteric fascia. Then inside that you will get the internal spermatic fascia. Okay, very good. That internal spermatic fascia, where is it? Here. Internal spermatic fascia itself is the fascia transversalis. So between this external ring what makes and internal ring what makes, in between that you have the cremasteric fascia. This makes sense. So this is skin. Then you have the campus fascia, scarpa's fascia, no doubt. Here then you have the external oblique aponeurosis, external spermatic fascia, which is nothing but a continuation. Then you have here you have the internal, what do you have? The internal ring is having the fascia transversalis. The fascia transversalis, please zoom out. Fascia transversalis itself is called as what? Internal spermatic fascia, isn't it? So between these two you have the cremasteric muscle and fascia. Makes sense. So internal spermatic fascia, fascia transversalis. Then going further inside, if you go, you'll get extraperitoneal fat and peritoneum. Okay, this is easy. You should hopefully understand this. So this internal spermatic fascia only will have the deep ring, isn't it? The defect in that only will be the deep ring. Defect in what? Defect in the fascia transversalis. Defect in fascia transversalis is the deep ring. Okay. Did you understand, guys?